Hello, I'm Professor Jungwon Kim from the Department of Beauty Arts at Yongsan University. I am dedicated to nurturing students to become creative and professional talents through beauty arts education. The scalp is a highly intricate structure that plays a vital role in both the health of the skin and the growth of hair. It is composed of several key layers, including the epidermis, dermis, and subcutaneous tissue, along with connective tissue, sebaceous glands, and a rich network of blood vessels and nerves. This complex anatomy allows the scalp to act not only as a physical barrier protecting the skull, but also as a dynamic environment that supports the life cycle of hair follicles. Functionally, the scalp serves multiple purposes. It helps regulate temperature, protects the head from external damage, and provides essential nutrients and oxygen to the hair roots through its vascular system. Nerve endings in the scalp contribute to sensory perception, which is essential for detecting changes in the environment, such as temperature and touch. Understanding the anatomical and physiological aspects of the scalp is essential for implementing effective scalp care strategies. Proper scalp care involves maintaining cleanliness to prevent the buildup of oil, sweat, and dead skin cells. It also requires adequate hydration to support skin elasticity and barrier function. Furthermore, targeted treatments are often necessary to manage scalp conditions such as dandruff, seborrheic dermatitis, or psoriasis, which can interfere with healthy hair growth and cause discomfort. By recognizing the importance of the scalp structure and function, beauty professionals and individuals alike can adopt a more holistic approach to scalp health, combining daily hygiene, professional treatments, and a balanced lifestyle to maintain optimal conditions for both scalp and hair. The scalp is a complex structure composed of skin, connective tissue, and blood vessels, serving as a protective barrier and supporting hair growth. Proper scalp care involves regular cleansing, moisturizing, and protection from environmental damage. Effective consultation and home care routines are essential for maintaining scalp health and preventing issues like dandruff and irritation. 1. Hair loss management. Hair loss is not merely a cosmetic issue. It affects self-esteem, emotional well-being, and overall quality of life. Understanding its causes, types, and management strategies is essential for future beauty professionals. 1. Definition of hair loss. Hair loss refers to the excessive shedding or thinning of hair beyond the normal hair growth cycle. It can be temporary or permanent, localized or widespread, and can affect both men and women. 2. Causes and early signs of hair loss. Common causes include genetic factors, hormonal imbalances such as DHT in androgenetic alopecia, stress, nutritional deficiencies, autoimmune conditions, and environmental factors. Early signs may include thinning at the crown or temples, a widening part, excessive shedding, or visible scalp. 3. Types of hair loss. Androgenetic alopecia, male-female pattern baldness. Alopecia areata, autoimmune-related patchy hair loss. Telogen effluvium, stress or trauma-induced shedding. Traction alopecia, caused by tight hairstyles. Cicatricial alopecia, scarring hair loss with permanent follicle damage. 4. Hair loss prevention and dietary therapy. A healthy diet rich in protein, iron, zinc, and biotin is crucial. Lifestyle management such as stress reduction, adequate sleep, and proper hair care routines are also important. Dietary supplements may support hair regrowth in some cases. 5. Hair loss management. Management includes both medical and non-medical approaches such as topical minoxidil, oral finasteride, PRP, platelet-rich plasma therapy, low-level laser therapy, LLLT, microneedling, and personalized home care routines. 6. Industry trends in hair loss. Current trends include personalized DNA-based treatments, AI-powered scalp analysis, integrative scalp clinics, and a growing demand for natural and sustainable products. K-beauty is also expanding its influence in global scalp care. 7. Hair loss consultation and home care. Professional consultation involves scalp diagnosis, client history, and lifestyle assessment. Home care recommendations should include proper cleansing, scalp massages, treatment serums, and consistent follow-up to track improvement. Number 2. Types of scalp and hair care devices and products. As technology evolves, scalp care integrates both traditional methods and advanced equipment for accurate diagnosis and effective treatment. 1. Scalp and hair care devices. Devices used include high-frequency tools, LED therapy devices, ultrasonic scalp massagers, and galvanic current machines. These tools promote blood circulation, reduce inflammation, and enhance product absorption. 2. Types of diagnostic and measuring devices. Diagnostic tools such as scalp scopes to magnify and inspect the scalp, sebum hydration analyzers for moisture-oil balance, hair thickness, and density meters. Thermal scanners to check scalp temperature. These devices allow for scientific analysis and personalized scalp treatment planning. 3. Scalp and hair care device products. These include specialized serums, exfoliating gels, ampules, tonics, and therapeutic shampoos designed for use with specific equipment. Ingredients such as niacinamide, panthenol, peptides, and plant-based extracts are commonly used. 4. Scalp and hair care procedures and products used. A standard professional care procedure may include I. Diagnosis. 2. Cleansing. 3. Exfoliation. 4. Nourishment. 5. Scalp massage. 6. Combing and hydration. Each step involves different tools and products aimed at treating specific scalp concerns. 3. Client consultation management. Effective consultation is the foundation of successful scalp and hair care. It requires technical knowledge, communication skills, and personalized planning. 1. Scalp and hair diagnosis. Assessment includes evaluating the scalp condition: dry, oily, sensitive, problematic, hair density, thickness, follicle activity, sebum levels, and dandruff. A proper diagnosis allows for targeted treatment. 2. Scalp and hair analysis. Using diagnostic tools, professionals provide a visual and data-driven explanation of the client's scalp health. This builds trust and enhances treatment accuracy and customization. 3. Client consultation management. A comprehensive consultation includes lifestyle and diet review, stress and hormonal evaluation, scalp care history and current routines, personalized product and treatment planning, follow-up sessions for progress tracking. Building rapport and educating the client throughout the process ensures long-term success and client satisfaction. Hair types vary significantly among individuals, including straight, wavy, curly, and coily textures. Each type possesses distinct characteristics that influence how hair responds to different products, environmental conditions, and styling techniques. Straight hair, for instance, tends to become oily more quickly and generally benefits from lightweight, volumizing products that do not weigh the hair down. In contrast, curly and coily hair types are naturally drier due to the spiral shape of the strands, which limits the distribution of natural oils. These hair types require moisture-rich treatments such as deep conditioning masks, leave-in conditioners, and oil-based serums to maintain elasticity and prevent breakage. Similarly, scalp types also vary and must be taken into account for a personalized care routine. An oily scalp may result in clogged follicles and increased dandruff if not properly managed, requiring clarifying shampoos and scalp exfoliants. Dry or sensitive scalps, on the other hand, Benefit from gentle, hydrating products that soothe irritation and restore the skin's natural moisture barrier. Tailoring treatments to match both the hair and scalp type is essential for maintaining overall hair health and achieving desired results. Holistic approaches such as aromatherapy and gua sha-based scalp therapy offer natural and therapeutic methods to enhance both scalp and hair well-being. Aromatherapy involves the use of essential oils like lavender, rosemary, and tea tree, which have calming, stimulating, or antimicrobial effects. Gua sha tools, traditionally used in Chinese medicine, can be adapted for scalp massage to increase blood circulation, relieve tension, and promote hair growth. These methods not only support physical health, but also contribute to emotional relaxation and stress reduction, making them valuable additions to modern scalp and hair care regimens.
Client consultation and scalp diagnosis are foundational steps in delivering personalized and effective scalp and hair care services. A thorough consultation involves gathering information about the client's lifestyle, scalp condition, hair concerns, stress levels, diet, and previous treatments. This helps professionals determine the most suitable techniques, products, and care plans tailored to the individual's needs. Accurate diagnosis through scalp analysis tools also enables identification of conditions such as excess sebum, dandruff, inflammation, dryness, or thinning hair. One of the key treatments in professional scalp care is scalp scaling, which gently exfoliates the scalp to remove built-up impurities, dead skin cells, and product residue. This process helps prevent follicle blockage and supports a cleaner environment for hair growth. In conjunction, scalp brushing stimulates the surface of the skin, promoting microcirculation and enhancing nutrient delivery to the hair roots. Finally, pre- and post-treatment consultations are vital to ensure continuity of care. These sessions allow for progress tracking, reassessment, and adjustment of home care routines. By educating clients on proper home maintenance, such as scalp cleansing routines, product usage, and stress management, professionals can help support long-term scalp and hair health, achieving sustainable results. Incorporating relaxation and massage techniques into the care routine plays an important role in reducing tension and relieving stress, which can otherwise contribute to hair loss and poor scalp condition. Techniques such as acupressure or aromatherapy massage using essential oils not only soothe the client, but also improve the effectiveness of other treatments by enhancing absorption. Proper cleansing and drying procedures are essential for preparing the scalp to receive active nutrients. Using mild, pH-balanced shampoos and ensuring thorough yet gentle drying help maintain scalp integrity and prevent irritation.
Brushing is essential for scalp health, promoting blood circulation and distributing natural oils. Use a brush with soft bristles to gently detangle hair, starting from the ends and working upwards. This process not only enhances hair shine, but also prepares the scalp for subsequent treatments, ensuring optimal absorption of nutrients and relaxation during massage.
The scalp, a specialized layer of skin that covers and protects the human skull, plays a vital role in both physiological protection and hair follicle function. This thin yet highly complex structure spans an area of approximately 700 square centimeters and contains an estimated 80,000 to 100,000 individual hair follicles, which serve as the foundation for hair growth. Despite its relatively thin profile, averaging about 1.5 millimeters in thickness, the scalp is densely populated with essential anatomical features. It is richly supplied with blood vessels, which ensure the delivery of oxygen and nutrients to the hair follicles, supporting their growth cycle. Additionally, the presence of numerous nerve endings allows for sensory perception, making the scalp highly responsive to stimuli such as touch, temperature, and pain. One of the most important components of the scalp is its well-developed sebaceous glands, which secrete sebum, a natural oil that maintains moisture balance, protects the skin barrier, and provides lubrication for both the scalp and hair strands. This oily secretion also contains antimicrobial properties that help protect the scalp from infection. Structurally, the scalp is composed of several layers: the epidermis, dermis, subcutaneous tissue, and the underlying galea aponeurotica. These layers work together to cushion the skull, regulate temperature, and support the anchoring of hair roots. The dermis in particular houses the hair follicles, sebaceous glands, and sweat glands, making it the most active layer in terms of hair and scalp health. Overall, the scalp functions not only as a physical shield for the cranial bones, but also as a dynamic ecosystem essential to healthy hair growth and skin homeostasis. Proper understanding of its structure is fundamental for developing effective scalp treatments and addressing conditions such as dandruff, inflammation, and alopecia. The structure of the scalp is highly specialized, incorporating a dense and intricate network of blood vessels and nerves that play essential roles in both physiological function and overall scalp health. The blood vessels are responsible for transporting oxygen and essential nutrients to the hair follicles, which is critical for maintaining the hair growth cycle. Simultaneously, the nerves provide sensory feedback, allowing the scalp to detect temperature changes, touch, and pain, helping to protect the head from potential harm. Sebaceous glands within the scalp secrete natural oils, or sebum, which form a thin protective film across the scalp surface. This oily layer not only helps to retain moisture, preventing dryness and irritation, but also contributes to the natural pH balance of the scalp. When functioning properly, these glands ensure that the scalp remains hydrated, supple, and resistant to microbial invasion. The skin of the scalp, though relatively thin and delicate compared to other areas of the body, acts as a crucial barrier. It shields the cranial bones from physical trauma and environmental factors such as UV radiation, pollution, and temperature extremes. Despite its thinness, the scalp's layered structure, including the epidermis, dermis, and subcutaneous tissue, offers both protection and flexibility. Understanding the anatomical and functional aspects of the scalp is vital for implementing targeted and effective scalp care routines. Proper care ensures a balanced scalp environment that supports optimal hair follicle activity and healthy hair growth. Moreover, recognizing the scalp's vulnerability to external stressors underscores the importance of preventive care strategies, including regular cleansing, hydration, and protection from environmental damage. By comprehensively studying the scalp's structure, beauty professionals can make informed decisions when designing treatment plans, recommending products, and educating clients, ultimately promoting both scalp wellness and long-term hair vitality. The condition of the scalp can vary widely among individuals and can be classified into several types, including normal, oily, dry, seborrheic, dandruff-prone, sensitive, and hair loss-prone scalps. Each type presents unique characteristics and requires specific care approaches to maintain balance and promote healthy hair growth. A normal scalp maintains an ideal balance of oil and moisture with minimal flaking or irritation. Oily scalps produce excess sebum, which can lead to clogged follicles and increase the risk of dandruff and scalp acne. Dry scalps, on the other hand, may feel tight or itchy and often exhibit visible flaking due to a lack of moisture or lipid barrier disruption. Seborrheic scalp types are characterized by overactive sebaceous glands and often display inflammation and yellowish scales, requiring anti-inflammatory and antifungal treatments. Dandruff-prone scalps may result from microbial imbalances, such as Malassezia yeast overgrowth, and need regular exfoliation and scalp cleansing products. Sensitive scalps are easily irritated by external stimuli, such as heat, cold, or chemical ingredients, and thus demand gentle, hypoallergenic products. Lastly, hair loss-prone scalps often show signs of thinning and reduced follicular activity, calling for targeted stimulation and nutrient support. The scalp houses both sweat glands and sebaceous glands, which play a vital role in thermoregulation and detoxification by excreting waste products such as salts, oils, and toxins. These excretory functions help maintain scalp cleanliness, but can also make the area vulnerable to imbalances if not properly managed. Due to the scalp's high sensitivity, it can react strongly to external substances, particularly chemical agents found in dyes, bleaches, shampoos, and styling products. Repeated exposure to harsh ingredients can strip the scalp's natural protective barrier, leading to inflammation, dryness, or allergic responses. Therefore, understanding the biological functions and unique needs of different scalp types is essential for implementing safe and effective scalp care routines. Beauty professionals must be equipped to assess scalp conditions accurately and select appropriate products and treatments to maintain scalp health, prevent disorders, and support overall hair vitality.
The hair papilla is a small, dome-shaped structure located at the very base of the hair follicle within the dermal layer of the scalp. Despite its microscopic size, it plays a highly significant role in the formation and continuous regeneration of hair. The hair papilla is richly supplied with capillaries and connective tissue, making it a central hub for nutrient exchange between the body and the hair root. Through its dense network of blood vessels, the papilla delivers oxygen, amino acids, minerals, and essential vitamins directly to the matrix cells of the hair bulb, which are responsible for producing new hair cells. As these matrix cells divide and push upward, they form the visible hair shaft. Without a healthy and well-functioning papilla, the hair cannot grow efficiently or maintain strength and structure. Moreover, the hair papilla plays a key role in regulating the hair growth cycle, which includes the anagen, growth, catagen, transition, and telogen, resting phases. Signals from the papilla influence whether a follicle remains active or enters a dormant state, meaning it also impacts conditions like hair thinning, alopecia, and slow regrowth. Additionally, research has shown that the hair papilla produces growth factors, such as vascular endothelial growth factor, VEGF, and insulin-like growth factor, IGF, that stimulate both blood circulation and keratinocyte activity. This biochemical communication not only sustains the follicle itself, but also contributes to the overall health of the scalp. In summary, the hair papilla is a biologically vital structure that serves as the engine behind hair formation, growth, and renewal. A proper understanding of its function is crucial for anyone studying scalp health, trichology, or advanced hair care therapies. The scalp, a soft yet highly functional tissue covering the cranial vault, is composed of 5 distinct anatomical layers, each of which contributes to the overall health, mobility, and protection of the head. These 5 layers are 1. Skin, 2. Connective tissue, 3. Aponeurosis, Galea aponeurotica, 4. Loose connective tissue, and 5. Pericranium. Each layer is uniquely structured and plays a specialized role. 1. Skin. This outermost layer contains hair follicles, sebaceous oil glands, and sweat glands. It serves as the first line of defense against environmental irritants, UV rays, and pathogens. The skin of the scalp is thicker than that of most other body parts and is highly vascularized, which supports hair growth and wound healing. 2. Connective tissue. Located beneath the skin, this dense layer is rich in blood vessels and nerves, allowing for nutrient delivery, oxygen exchange, and sensory input. It also helps anchor the skin and follicles in place. 3. Aponeurosis, Galea aponeurotica. This tough, fibrous sheet connects the frontalis and occipitalis muscles. It provides structure and tensile strength, allowing the scalp to maintain its shape and support facial expressions. 4. Loose connective tissue, sometimes called the danger area of the scalp due to its susceptibility to the spread of infections. This layer enables the movement of the upper layers over the skull. It allows flexibility and is often targeted in scalp massage and therapy. 5. Pericranium. This innermost layer lies directly on top of the cranial bones. It nourishes the skull and plays a role in bone repair and regeneration following injury. Together, these layers not only serve to protect the skull from visible trauma, but also contribute to aesthetic and functional aspects, such as hair growth, styling potential, and scalp mobility. For example, the presence of hair follicles and sebaceous glands in the top layers makes the scalp an active biological site that requires proper hygiene and care. Understanding the layered structure of the scalp is crucial for beauty professionals, especially when applying treatments like scalp scaling, microneedling, massage therapy, or clinical procedures. Each layer responds differently to stimulation and pressure, and awareness of these differences enhances the effectiveness and safety of scalp-related techniques in both salon and clinical environments.